working with the Miami County Health Department on protocols that our district, parents, students, everyone in the community that deals with the health department and anything with COVID will follow this year. I appreciate Miami County Health Department's work. We sent a lot of items back and forth. I know I sent you a draft last Friday, and then since then have worked on what we see in front of you. The health department has approved this plan and feels like it's a good plan moving forward under our current situation. So I'll pull it up and we can go through it and discuss it. And this will be attached to the 2-page document and put on our website as well. So phase 1, which would be where we're currently at, no evidence of school-related COVID-19 transmission. The school will remain in a mask-optional environment. We did list our mitigation strategies that we currently have in place other than the mask. So just like everyone that just walked through, here at Circle Grove, the Panda camera got you, and so I didn't get any text messages, so no one in this room has a temperature of over 100.4, or we would know that now. But that is that first one, so we have all staff, students, and visitors go through those. In fact, we have those at our activity entrances, so at the gym entrances at the middle school and high school, they're at those areas as well. So, which is used daily at the middle school by our students. The high school gym entrance, obviously that's just usually used during activities, but all the students at the high school either go through the main entrance or the bus entrance, and both of those have one of those cameras as well. Of course, proper hand hygiene is promoted. We have hand sanitizer stations throughout the building. We have seating charts for our students. 3 feet of social distancing will be encouraged. Any individual believed to be showing signs and illness be evaluated by a school nurse. We have plenty of masks if anyone would like one of those at all of our buildings, all sizes, all different kinds. The county has helped us with that. And then we do have alternative seating plexiglass, so I know our principals have had individual conversations with parents regarding that, whether it's in the classroom, whether it's at lunchtime. As you know, we had a lot of plexiglass last year. We didn't throw any of that away, and so we can set up, and we actually have, like at the lunchroom, some plexiglass tables that if students wish to set there, they can do that. As far as COVID-19 case and close contact reporting, we will notify the Miami County Health Department when a positive staff member or student is reported to the district. Usually, obviously, on that, it's self-reported. So a parent calls us and says they're keeping their kid home because they've tested positive, or a staff member calls us and tells us, or calls their supervisor and lets them know. So obviously, they do need to stay home and get healthy. The health department will notify us when a student or staff member is required to undergo a quarantine or isolation. We will maintain a table or link on the district webpage for a week to week. On the district webpage to a week. I need to change that to make that sound a little bit better. But anyway, weekly reporting. We did not do this last year. I mean, I'm fine with that. In fact, we do keep an internal table, and it is the health department has it as well. I was just going to show you. Now, it's a Google Doc. This is just a spreadsheet, but it's the same thing. So this is what we kept last year, and this is what we will keep this year. So if we have a positive staff member on this table, we highlight them red. If we have a positive student, it's kind of gold. So first name, last name, building, position, grade, were they in the building 2 days previous? That's important for the health department or KDHE when they start their contact tracing. Date entered, staff entering, so usually it's our nurses. And then date tested result, date can return, where that's been confirmed by MCHD, KDHE, a medical doctor, and then over here, any notes. So this spreadsheet is populated daily. Last year, the district was required to, on Fridays, report to KDHE this information. So this year, though, KDHE is not asking for that. So it's not difficult for us to do what the plan says, because if we do it on Fridays, we were doing a similar thing next year. So I'll just have Jenny put a tab, COVID-19 on our website or with these documents, and we will update that accordingly as well. As far as
that wouldn't have names, right?
No
Okay.
names.
Because I wouldn't
No.
have names.
This obviously does, but this is a confidential document that we have. As far as active cases, we have one confirmed case for all of our students and staff currently. So let's hope and pray that stays the same. I know it won't, but if you're curious, so on our spreadsheet, currently, if you were looking at it live, you would see one on here. You would see other kids listed because maybe a parent has called their child in and say, I'm keeping my kid home, monitoring them. We were at a birthday party and there was a positive case at that birthday party. So we enter them here. So it's just not, we are entering data, but it comes from all forms. It comes, like I said, from a parent, it comes from a staff, a student, or whatever. So it's just kind of a big log, just not positive cases. That's why they're...
Okay, that's what I was going to ask.
Yeah,
Not
it'd be
just positive
probable
anybody.
or people
Yes.
that are just
Everyone's on here, so that's what our nurses are. That's part of the triage that I think is important. So there are many more people on this list on our internal spreadsheet than get the red or the yellow as well. But I did want to show you kind of what we do, and the health department has access to this as well. Let me pull that sheet back up. On this right here, so employees, students, families be notified if they are identified as a close contact of a COVID case. The health department is asking me, and I told them I'd ask you, if the board and the district would be willing to help in that, not obviously on anything with the close contact identifying, but after, say we have kids identified in a class, football team, whatever, if once they have identified 20 kids and they put it on a form letter, if we would be willing through our email or Skyward to send it to those kids that have been considered a close contact. I said I would ask. I know that was a topic of concern maybe last year, and so I wanted to bring that to you. They have told me that they would appreciate that just because of the capacity that either the health department or KDHE has, that it will take them longer to contact each of those families or those students. But
They would identify them.
They would
want
identify
us
them.
to notify the families.
Everyone in this room, you were students and we were playing on a team or at a party or whatever, and they said, everyone on the board needs to be, they're considered a close contact. Here's a form letter. Will you email it to these guys? We wouldn't blast it to anyone else except who they've identified as a close contact. But I said I would ask this body.
I'd say sure. I'd have I guess 3 conditions. One, we have to clearly state so that there's not confusion from our students and staff that we are sending this on behalf of the Miami County Health Department. It's not coming from us, it's on behalf of. That's one. 2, I wouldn't want to do this just for somebody who's a student if the close contact didn't happen in the school building. So if the close contact happened outside of the school building, that's not on us to send via our systems.
Okay. So like the birthday party, no.
Yeah, birthday, that's not us, you gotta send it on your own. And third is, I do expect every single one of those letters to follow the statutorily required language in KS 65-129C. Because I know for a fact that a couple of those letters that went out last year did not follow all the statutorily required language. So if we're gonna send it over our system, I expect it to follow the letter of the law.
Okay.
Now, in the close contact, in that, does it state, do they have to be quarantined?
Yeah, we're going to talk about that, and I think there's a lot of good items in here regarding close contacts. I think you will appreciate some of the changes that the health department has agreed on that one. Okay, so I got those 3, and here we go. COVID case investigation and contact tracing. Obviously, MCHD or KDHE will be responsible for that. We will cooperate. So I use. You probably heard me, contact tracing, kind of like the word investigating, if it even says investigators there. So we are required to help with that, just like if a police officer walked in and was investigating some crime, they're doing the investigating, but they're going to ask our teachers, our principals, coaches, whoever's involved, students, what happened at that time and things like that. So that's how we cooperate on a case investigation. MCHD and KDHE are the lead investigators, but they do obviously ask us for items, maybe who was on the field at that time or who was in that classroom. Obviously, as you saw, we do have seating charts. We have cameras all over the place, so if there's something at the lunchroom, we can pull lunchroom cameras and footage for that as well. As far as a close contact, we will go off of their definitions. So and so whatever they define as a close contact, we will go with that, and then we will work through that. Attendance, quarantine, and isolation orders. All students exhibiting signs consistent will have their parents notified, proper health procedures followed. Students and staff given a quarantine or isolation order from Miami County Health or KDHE will be expected to comply with the order. Evidence of COVID transmission within a school building. So when we enter phase 2, this will be by building basis. Evidence of community transmission in schools will be demonstrated by close contacts of those individuals testing positive for COVID becoming active cases themselves. So, and this is where, Landon, I think you're getting to on what they've agreed on, what's called a modified quarantine. So if any student is considered a close contact, first they'll look at, has that close contact been vaccinated, had COVID in the last so many months? That one is changing. I believe it's 6 months. But they will probably not be quarantined. I mean, obviously, if they're exhibiting signs of symptoms, they need to. But if they're asymptomatic, they will be fine. A close contact of a student, friend, family member who tests positive in a low-risk setting determined by the Miami County Health Department will be allowed to continue in-person learning so long as the student remains asymptomatic through the incubation period. Mask will be worn by that student or staff in the classroom for a period of 14 days since the last potential date of exposure. Now, if a student doesn't want to wear a mask and they're considered a close contact, and I don't have it in here, but we can add it, or we just know this is another way to do that. There is a testing protocol that the health department, and this actually will go into effect for our high-risk settings as well. So on the soccer field, or even band is considered a high risk. And this is what you see like the NFL and pros where they're testing every day. So making sure I have it right. So what Christina says, if they would test with a rapid antigen test every day, they would still be able to come to school as long as they're asymptomatic. They would still be able to play football. They would do that until day 6. And day 6, when you take that rapid and that's from exposure to that positive case. If you still test negative on day 6, then you are fine to continue. So,
now who pays for that antigen test?
No, that's free. I mean,
well,
the federal
a normal person, through the school it is, because a normal person has to pay like $25-30, I think, to have it done.
No, it's free. When you go, maybe Rob can shed some light. But
we sell them, but you don't. Other places do it for free.
Okay, because I know Auburn, I think it's $25 or $30.
It shouldn't be.
Really?
Yeah, I've been told that's free. Of course, we do it. We talked about our nurses doing. I mean, like we could do that part. I do know in talking to Osawatomie and Paola, they are going to do that. They did qualify or sign up for that KDHE grant. I know we chose not to do that, and I'm not saying either way, but we could do that. So when something like that, a kid playing football, been considered a close contact, and obviously it's that kid can still come to school. They can wear a mask as long as they're asymptomatic. They can come to school, but if they want to play on the football team. Obviously, we don't want them to wear a mask under that helmet, especially in the heat now. But they could still play football if they go get that rapid antigen test for 6 days. Well, the 6th day of close contact. So if they're not identified a close contact until day 4, they would just have to do it 3 days, day 4, 5, and 6. And it just depends when a close contact is identified, because that takes a while through contact tracing. Sometimes the close contact is identified after day 6 as well, but go ahead.
No, I was just saying, yeah.
Okay.
It just takes
But in our letter that we would be sending, when they say close contact, they're going to tell you in the letter which ones to say they have to be quarantined or not.
Well, and no one even say they're quarantined. They'll identify them as a close contact,
that's all
and then they'll allow this that
based on the rest of
you
it.
don't have a temperature, experiencing no symptoms, and you're in school willing to wear a mask or at least go daily and get this rapid antigen test, you can still stay in school.
Maybe the person that got checked
they
out
would,
too.
so they have to outline basically quote unquote, what are the terms of the
Okay.
quarantine? So
Yes.
it'd be MCHD that would basically say, because of the nature of your exposure, you're considered low risk, you can participate, you can choose either modified quarantine, or they would put whatever a standard quarantine is, which I'm sure they just kind of take whatever the CDC language is, either the 7-day at home abbreviated or the 10-day or the 14.
Right.
I would assume that's how they would do that, is just give people their options, but they're gonna have to tell people what it is that they want them to do.
Okay. I may be confused on that antigen test too that they had. They paid for it. May have been another test too. I don't know.
Yeah, I wanna
Something
It
to do
might
with
be the
COVID or
antibody
something.
test that they're.
Could be the antibody.
That's what it was. Yeah. Okay. Yeah. That's what.
Yeah,
Maybe
so I've
that's
heard
what it was.
these are free at our local
Okay.
pharmacies
That
and the health
okay.
department as well.
That's
so
what
there
it
won't
was.
be any
Probably.
cost.
Yeah.
As we discussed, we would have the option to do that. The board chose not to, and so we will just then, they'll work with our local partners, VOS, Auburn, Miami Health Department, to go get those. And that, as Dr. Shane will be based off what day they are. If they're finally notified and it's day 4 or 5, then they'll know they just have to go get those a couple days as well. So if they're a non-athlete and are okay with wearing a mask, then really it's A and B. Where high-risk activity comes into play would be where then they go get these tests to still not only stay in school, but to still be able to play soccer, run cross country, those things. Like I said, very similar to what you're seeing on professional and college levels, where those athletes are being tested every day, or we actually saw that in Olympics as well.
And then does the responsibility fall on staff to monitor that they follow this, or how does that work, or who does that fall onto?
We'd probably ask them to present the test result to the school nurse before entering the school.
Because there would have to be some sort of something to make sure that they're actually following what.
Yes, because we will be identifying up top. They'll tell us who a close contact is. They'll go on that spreadsheet. So this will be kind of a new that, our nurses then will be monitoring that daily log that I showed you. That said Michael came in on day 3, tested negative, day 4, be communicating. And you don't have to get up to day 6. So if it's day 3 and Michael's playing football, he can still play even though he hasn't made it to day 6. Day 6, negative test, he's cleared. That he doesn't have to no longer do that as well. So if we want to add that part, or we just work that out with families, I just knew that we weren't wanting to test, so I didn't know when it actually came to testing. I believe if we're wanting to keep kids in school and keep kids active that aren't positive, it's a good thing. We will do that. I just don't know under here if we want to, I guess between B and C, put a new C and add that testing rapid antigen test is available.
Yeah, or in B, you could say 2 options for modified quarantine will be available. Then sub-bullet will be, 1 is mask worn for 14 days. 2 is, rapid antigen test daily for 6 days.
Okay.
Whatever, and it's 2 sub-bullets out of item B.
I know last year, obviously, as we know, that was a big concern in the community when kids were quarantined and lost, playing time or whatever. And I know parents wanted this option last year, and it wasn't there. I know there's many in this room that, as parents, were affected by this, and so I see it as a good thing that if Kyler, who's a sophomore, my son, comes down with, or is considered a close contact, we could take him down to Auburn and we'd monitor his symptoms. I don't think anyone disagrees if your kid is sick, COVID or not, they need to stay home and not play football. But if they're fine, just go get them tested and show that. So I think it's a great step in the right direction. That caused obviously a lot of concerns last year that I think will be alleviated this year. Okay?
Brian, before you move on, so getting into phase 2, what is there some type of a threshold, because it says building by building basis. You said we have 1 case right now, so at what, there's got to be some type of a threshold there that is a trigger that we say, here's what we're gonna do now because of this.
I think that's two. So take that one we have, if there would be any evidence that that one positive case, so whether it's on the volleyball team or in a classroom, that we start seeing a trickle effect and those close contacts have been identified. So like, for example, in that one positive case, there's been no close contacts even identified by MCHD or KDHE.
Yeah, and arguably that case would have been acquired before the school year started.
Student was positive on the first day of school, so yes, I mean, yes.
So in this instance, then Miami County and everyone has done, and we have followed these procedures so far
Yes.
regarding that one case.
Mhm.
They've investigated it.
Yeah. And I think like what Doug said, it's before school, so if there were close contacts, maybe the family was considered that, but we have not received any communication from MCHD that one student had any close contacts that are in our buildings.
Were they in our building?
Well, the student Tuesday was positive and went home, and that was the first day of school, except freshmen and seniors. Or sixth graders and freshmen. And the student was not either one of those grades.
So is that kind of on John's point? So does that mean just one evidence? Like if one person has a close contact in school and that person becomes an active case, now that has triggered phase 2? Or is
For
it
that
like
individual student, not for
Okay.
the building.
not for the building?
Yes, yeah, that's not, we go building on this, that's based on close contacts. Well, this is really talking about the modified quarantine, so yes, it'd be by case basis, building by building basis on that, so.
So this sounds more like case by case and not building. So something where we said masks will be worn, it says by students. When you said that, you said by the student. So I would have taken this to mean, well, I had questions for clarification. I would have taken it to mean that a classroom of students, but based on the way you read that, it was the one student in a classroom is going to mask.
All of the kids or staff that are considered close contacts in that classroom will, but that would be up to the contact tracers.
Why don't we add clarity to that sentence if that's the intent?
So on B,
Well, what is the intent? That was my question I had written down before you even said that.
It's a fair question.
I don't really know who is supposed to mask there.
So I guess it would be, is that defined then on A, close contacts?
Mm-hmm.
So that would be maybe, I don't know how to have that
I mean,
go.
I guess B, we could say masks will be worn by close contacts, take out students and staff. Cause that's what that.
And maybe instead of in the classroom, in school facilities.
Yeah.
Masks will be worn by close contacts in school settings, that way. Okay. And then I know I'm gonna add the testing part to B as well. So that will say masks will be worn by close contacts in school settings for a period of 14 days since the last potential date of exposure. And then put in there about the testing, rapid and antigen test every day until qualify for the shortened quarantine, which is the 6-day testing negative.
So they either need to
What's
wear
that?
the mask for 14 days or
Yes,
Or
test every day,
test every day.
and show a negative, or they would be excluded from school and activities.
One or the other.
Yeah. Or the third option, they don't want to wear a mask,
Yeah.
don't test, they are going to be asked to go
Yeah.
home.
Three options, really.
Yeah, really 3 options. Hopefully we don't have that, but that is the third option. And we work with that family and push work home and all that. They wouldn't be able to, if they're in sports, obviously would not be able to show up to that.
and does that go into the 40 hours of remote for that student?
Yeah, so we have to monitor that. And our secretaries and Jenny works with all of that. That'll be another item we're gonna have to track as well. And then on attendance, so when quarantines and isolation orders are given, Obviously, the health department has issued those quarantine isolation orders, and as I said before, we'll ask people to follow those. So all individuals identified as close contact, confirmed COVID-19 case will no longer be eligible for a modified quarantine because they have been issued a quarantine or isolation order. So that's where it's different. That's not your close contact. The health department has issued you, as it says here, a quarantine or isolation order. So if you have a quarantine or isolation order, you would not be eligible for a modified quarantine.
So I guess let me go back to what I said earlier. I still interpret the modified quarantine as a form of quarantine order. Right, so if MCHD is going to direct that and tell a student or staff member that you need to quarantine, this is one of the ways in which you can do it, that's still a quarantine order. So we might want to check
Okay.
Yeah, I was confused
this
too.
language. Yeah, because
Under what circumstances would the health department say that they're a close contact, but they have to quarantine at all or isolate at home?
now if MCHD was saying if there's evidence of in-school transmission, we're not going to offer modified quarantine, then we need to probably move modified quarantine up to phase 1, and then this is the statement for phase 2. So we might need to double check what MCHD was
Okay.
trying to go for. Okay. And I think before I'd want to go to totally shutting down the ability to do modified quarantine, I'd want to make sure that modified quarantine wasn't good enough to stop in-school transmission. Like, so if it's not stopping it, then of course, yeah, then we're not doing it anymore. But if it does stop it, then there's no reason to discontinue the practice. So if there's close contacts and in-school transmission that's happening outside of modified quarantine, then that doesn't mean modified quarantine doesn't work. It just means that there's transmission happening outside of modified quarantine. So I would just want to make sure that we don't throw that away unnecessarily.
Okay. I will check with them on 5, what we're seeing there, for some clarity on that. And then phase 3, where we do have the health department, and our evidence shows there is within the school building. We would, as you guys said, even in the last Monday's board meeting, we would call a special board meeting, a kind of a threshold that I heard, and actually I went on the low end. You had said 5 to 10 when I told you 30%, and that's just was. When I said 30%, the health department did tell me that, but that's really for any infectious, and that's just not Miami County. That's been kind of rule of thumb for many years. I mean, I know even they would think that's too high. You guys did as well. I thought I heard you guys say about 5, 10, so I went on the low side. So if we did have a positive case rate active of 5% in any of our buildings at one time, so that's not cumulative, but at one time, we'd probably want to call a special board meeting, or be what it says in here, to discuss temporary mitigation strategies, whether that's mask on for a little bit, whether that's, as the last sentence says, that would be up to you. We would have current data, current recommendations from MCHD or KDHE that I'd bring to the table to help you make that decision as well.
So instead of 30%, we're using the 5%? Is that per building?
It'd be per building. So, because I would think that would be alarming numbers. High school hovering at 600, so that would mean we'd have 30 active student cases at one time at 5%. Middle school hovering at 400, that would be 20 active cases at one time. That sounds like a large number that I think we need to at least get around the table again, see what KDHE and MCHD is saying about, are we seen clusters or outbreaks that we do need to look at some other mitigation strategies. But ultimately, that's your decision to add more, or what it says on the last line, to temporary closed schools. Then it goes back to Michael's point, then we would jump into remote learning for that time as you guys deemed we would need to potentially close. So.
Also up on 6 up there, the 2 full incubation periods, is that 28 days? is 14 days considered the incubation period, or what is the too full, on number 6 where it says no longer, then we can go back to phase 1, what is too full incubation?
Full
Is
incubation
that
is-
28 days,
yeah.
or is it, okay, 28
Yeah.
days,
So that
okay.
one incubation period is 14 days.
Okay,
Yeah. And I think they wrote it that way because their guidance and things have changed too. I mean, there'll always be an incubation period. Right now it's 14, but if it goes to 10, then they'll still follow that, and it would recommend we do. But if an actual incubation period changes, then we don't have to rewrite that because they'll always, from CDC and everyone, always have an incubation
Yeah.
period. But right now, yes, it is that.
And is that automatic, or do we have to come back and meet? Like, is there any decision that has to be made by us, or is it just as soon as the 28 days is up, we're automatically back phase 1?
Yeah, I mean, that's what it's reading.
I think we need something similar in phase 3. I don't think we need to wait to have the 3 days and schedule a meeting to say there are some things we can put into place if we get to that point, such as masks, such as better distancing, putting up some barriers, some of the other mitigations that we're not using even at phase 2. We don't have to wait for a meeting, which is going to take 3 days in order to put those together.
It does and it doesn't. So yeah, this was a 3-day notice by law, but we could actually call a special board meeting quicker than that, and then Jenny you guys would sign a waiver that obviously we didn't have the 3-day public notice. So now either way, I'm telling you there is a strategy, or we can call a special board meeting within an hour if we needed to. You guys would
I
just
just
all be
think
asking.
there's some things we can do that doesn't require us to get together to
Well, I
talk
think
Yeah, I
about
don't
it,
know
at
you
least
want
get
to
the thing
hand,
going.
I don't think you want to tie your hands though.
Well, I don't know. That's
Yeah.
I don't want to wait for a meeting when we can decide up front. Well, there's at least a couple of things that administrators can do in their
or at
buildings
least
to
they can
take care of it.
expect at phase 3, at least expect that could be an option, or I don't know,
I think you don't want to tie your hands too much, just because 5% can present itself in many different ways, right? So is it 5% spread all the way across the school building? Because what you might want to do will look very different than, was that 5% all one classroom? And so then taking care of that issue is pretty straightforward because you have to address that classroom. And so I think if you kind of do broad sweeping mitigation intervention, then you might be just casting broader nets than might be necessary depending on what the situation
That
is.
is kind of the point. You're right. It is a broad
So-
net, and I go back to the list of strategies and layers that we are given as options and recommendations, and we're only using a few of them right now as it stands, and combined with Miami County, doing a little more. So, I think if we at least say it here, then we can get some things moving faster without making an administrator or a student or anyone feel, oh, well, I have to make this decision now. I mean, we're already frustrated enough that we're expected to make this decision. I hate the idea of passing that on down. So we can at least put some things in place up front that doesn't require waiting for a meeting, but we'll get to that.
I think some of that would be addressed because I would assume we'd probably pass through phase 2 before getting to phase 3, right? So those things in phase 2 would be in effect before we even got to phase 3. So there would be at least some of that already detailed there.
Well,
in
I
phase
thought
2.
so, but after hearing the explanation, the measures are very narrowly focused within the buildings and the classrooms, which after hearing your explanation, that was a little surprising to me. I read some of these instructions a little bit different than what they were intended.
But like Jacob's saying, in 2, I mean, obviously every positive case is not there. Every close contact is either wearing a mask, being tested every day, or not there. So a lot of mitigation strategies in phase 2 that hopefully help us never get to phase 3.
There's nothing that precludes us from having a meeting before you hit 5% either. Just as that's an absolute trigger that we will need.
And they're still saying it's close contact, so a student that has 5 different classrooms they go to with all those different students, all of them are gonna be considered close contact.
Within 3 feet.
Yeah.
'Cause all our classrooms are considered low risk.
Okay.
And so
Why are they considered low risk?
a classroom is a low risk setting.
Oh, just activity.
Yeah.
Yeah,
Activity
okay.
risk.
So where it changes is high risk. So
Okay.
sports, PE,
And
band.
how are they,
Where
they
they're
define that based
physical.
on the activity because of the just breathing and interacting?
Yeah. And they have to identify that.
Yeah, I mean, the way that most of the classrooms are laid out, most students should not be close contacts.
Yeah, maybe one.
Have you seen any of the classrooms?
I've seen the picture of some of the English classrooms, and there's certainly groups of students that will be, but broadly, like, they can't circle the whole classroom and say this whole classroom is a close contact. It's maybe this group of 4 or this group of, and so, I think that if we get into a phase 2, we could definitely encourage teachers, let's think about different strategies just to minimize the number of students that that could be considered a close contact. As long as we're still following the 3-foot game. You're not gonna be able to separate all students by 3 feet, but, even with a standard desk arrangement, there's only so many students that can be within 3 foot of one person at a desk. So I do not see MCHD coming in and saying, nope, we're quarantining your whole classroom because they know that that's gonna cause big problems.
No.
Yeah, that's the thing. I was
And it's not
about.
following their own definition.
They've already shared that will not happen in a low risk setting. They didn't do that last year and they're not gonna do that this year. So they're gonna read what we have, trust us, work with us, and they've told us that won't happen. If you're curious, just a little data on kind of where we're at now. This is not scientific, but I had how many students are wearing masks. Staff, I would say, if I had to guess, probably less than 5% of our staff are wearing masks. At Rockville, Ms. Fleming, it's about 13% of our students have masks on. When she did a kind of a point in time look, like I said, no scientific, but she went around. About 12% of our students at Broadmoor. I'd guess at the middle school and high school, and I have kids at the high school, it's less than 5% of our students at those buildings would be. Like I said, don't hold me to any of those numbers. Those were just kind of point in time observation data points as well. But if you were curious on how much mask
I'm
we're
glad you-
seeing,
I was interested.
48 kids when Emily at Rockville, about 40 at Broadmoor. And most of our staff are as well. And another point I wanted to show is I know this has been discussed on, especially when it comes to COVID and classes and out of district students. And we've always allowed out of district students there, so we've not changed any of our policies. What I did for you is I show last year. So if you're looking, this is Rockville, Broadmoor, middle school and high school. Where these kids came from, and this year where they're at. Last year we had 32 out of district. This year we have 38. Several things on this. First, we have a very extensive out of district application. You have the parents that want to come here have to fill out an application annually. On it, they have to, say it's a kid from Blue Valley Southwest. Looks like we have one on there, or last year we did at the high school. We have to see if they're a kid in good standing at Blue Valley Southwest. What that means is their attendance, their behavior, their grades, their fees. So those 4 things we ask Blue Valley Southwest. What are their grades? What are their behavior? What's their attendance? Are they behind $352 on fees or whatever? That is annual. So even if we accept that kid from Blue Valley Southwest, they have to go through that same form next year, and that the gatekeepers are the principals as well. That's one thing. So we do have a form. It's on our enrollment tab that parents have to fill out. Probably about half of these kids you're looking at are staff member kids that staff work here. They just ride in the car with their kids down here, or with their parents down here or up here. The other thing I want to point out is about half of them are Miami County residents. It's nothing against Paola or Prairie View, but they live on the eastern side of the Paola School District. Either their parents work here, so for example, Coach Ebenstein, his two boys are coming with him over here, and he lives in the Paola School District now. Or look how many are in Prairie View. As you know, the southern area of Miami County is Prairie View School District. So either they, even though they feel like they're closer to Louisburg, even though they're in Prairie View School District, or their parents work in the metro, and so they drop them off and they pick them up, or they actually work in Louisburg. We have some people that work in town here that have little kids that are in the Prairie View School District that drop off their kid, work here, and go home as well. So I just wanted to share that as well.
And we do get full state aid for these.
We do. Missouri, you see a few of those. If they're staff member kids or they were here before the law changed a few years ago, we do. So now, any Missouri kids we do not take because we don't get any funding for them unless they're a staff member's kid. So we used to have some Drexel, Cass Midway kids come over, and we did get funding for them. That law changed 3 or 4 years ago. So, but you can see very few on there. I know the other thing's been talked about, and it's kind of small up there, but enrollment numbers getting big. Maybe, are we taking out of district kids just for the money? So what the district topped out the all-time high in 2012, 2013 at 1737. 2 years ago we were at 1706.4. Last year, way down, 1523.9. An estimation this year 1670, maybe 1680. We do not get funding based off this year. So we could have 5,000 kids in Louisburg this year and we would be funded. How we are funded is the higher of those two numbers. So this year's funding, we are getting funded for 1706.4 kids. So next year,
We'll be between those other.
and we will be down. Our funding will be now. Our funding could be stable because the state is going to put more money, what we call the base, or on an FTE. But I will be closely tracking that because we were fine this year because we used 1706. Every district was down last year. I mean, Blue Valley, instead of 30,000 kids, what you saw, they might have had 25,000 or 26,000 or whatever. So you can see our big drop last year as well. So we are up, but we're still not. So we're 30 or 60, 70 kids down from the all-time high 2012, 2013. So at times I know you hear schools are full. That's an incorrect statement. There are times classrooms are full, but not schools. If our schools were full, we made a mistake with our bond issue because we didn't build more classrooms. And we talked about that early stages. We have room to grow. Rockville has 8 pods for classrooms. We have the most is 6. Broadmoor, we know, has plenty, especially when we remodel that. Middle school was our closest, but we are building that high wind shelter. Is going to be 3 new science classrooms, so that's going to give us some room there. High school, if you walk the academic hallways, there's still areas that don't even have lockers. They have the bases where the lockers are supposed to go. So that's a big difference of some classrooms are full versus schools. What happens at the secondary level is, average class sizes might not be too bad, but then there's a class that a teacher might have a 29 or a 30. Another hour, they might have 15 or 16. And what happens at the secondary level are what are called Singleton Classes. So it's when band is. It's when Jim Morgan has a ag class. It's only offered once. And we want kids to take what they want to take. So when they enroll with their parents every year, they say, I'm taking band. I'm taking Mr. Morgan's ag class here. I'm taking Art 3. They're offered one time at Louisburg High School. So you pigeonhole that kid. And then they also have to take all the required classes, English, so then the counselors are trying to put that kid in there. And that you replicate that schedule 600 times with that individual kid that wants those classes. That's why you see, we wish if a teacher's average class size was 21, or 22, they could have 21 or 22 kids. But when you put those Singleton classes in there where there's all of a sudden 1 hour, 110 kids in band, probably a core teacher is going to have 15 in his or her class. When there's not band, or when Allison Moore doesn't have, I mean, she's getting big choir numbers, when they're not there, then class sizes on the cores become bigger. So that's tricky. There are mitigation strategies we could look at different classroom settings. You guys, a lot of you have had meetings in room 108 at the high school. That's a bigger classroom. Auditorium, band's only part of the day, choir's only part of the day. Those are big classroom settings. So we could move teachers on some of those big classes as well. So there are potential mitigation strategies, or taking a look at that as well. And that actually is outlined in the plan, where staff and admin may modify schedules as well. So we could still look at that as well. But I just wanted to share this as well, because I know some of this has been discussed. Would I like to be back at 1737? Yeah. And I Louisburg has a high homeschool population because there aren't any homes for sale. If you talk though to some realtors, Doug Bowes and others, a lot of these new homes are empty nesters. So even though, so they don't have kids in them, their grandchildren live up in the metro and they grew up in a small town, so they come back to Louisburg and can drive 20 minutes to their grandkids' activities. So, and our class sizes, I mean, now we do have 126 kindergartners. But our class sizes at the high school, and I don't have on this list, but there's something like 2 of the classes are in the 150s. Our largest class is our freshman class. I think it has 157. But I keep a big spreadsheet, and I'll show you all the colors like I had before after September 20th, our official count date, because I track that. But when we lose 100, I think we have 143 or 145 seniors, and even if we just have 126 kindergartners, I mean, we will lose a little bit. Seems like always our high school are the largest classes. We do get a few kids from WIA. That's always, you never know. Some years we get 1 or 2, sometimes we get 8. It just depends on where those students that we are coming from. Some are Spring Hill kids or Blue Valley kids or Missouri kids. So we do usually get the kids with his last name or Getterman's or others like that, but it just depends. So that's always kind of hard to estimate how many we get from there. But I did want to share that with the board as well. Not that changes any of the safe return to school items, but I kind of wanted to visit about the mask, what we're seeing, and then also the students, because I know those have kind of been topics that have been discussed in the community as we're talking about this plan and what we're doing.
Can you go back up to modified? I just want to see if we could add something to say, unless otherwise directed by Miami County for a isolation or home quarantine or whatever. But I don't know how we're going to clean that up. What do you?
Will be allowed to continue so long as the student remains isolated. Yeah, because it's going to have. This comes from MCHD. It does not come from us. This issuance of a modified quarantine,
Which is
Right.
will be allowed to continue. So
But down
long
below
as,
there's a separate one saying.
and maybe put after the incubation period and permitted by MCHD or something along those lines. Because again, they're the ones that set the rules for quarantine, not us. I see what you're saying though. I think that's one of the sources of confusion from last year, is that it was unclear to people. So whose call is it? Who has the authority in this matter? Who doesn't? So I think anytime we can introduce clarity to that for our staff and students and parents, then that's helpful. Sorry, Michael.
I was just gonna say, are you just assuming that it may have to be a longer time or something, and so or
Well, down below it says, I think quarantine, isolation, and I think there was some little confusion on that.
well, and I do need to. It's this one. I need to get clarity from them.
Yep.
I have that note.
And then back up and modified as well.
Yeah.
Dr. Berman, item D probably doesn't need to fall within modified quarantine. It probably just needs to be its own if it becomes item 4. So staff and admins may modify schedules and activities to minimize risk of potential transmission.
Okay.
So
So then we'll change all
as
those
opposed to
numbers.
being modified quarantine, like maybe in phase 2, that's where
Just
to
a
John's
separate
point.
bullet.
Yeah, so to John's point, right, like we start thinking about what are some other less restrictive things that we can make sure that we're implementing, right? And maybe even add in there with modified schedules and activities, we could include something along the lines of modified seating or creating intentional cohorts or something like that.
All right, so to recap, really I didn't hear much in phase 1. In phase 2, it's going on a,
Other than maybe modified quarantine moves up into phase 1. Cause MCHD would offer that in phase 1 as well as phase 2. Correct?
yes. So do I put it in both or just
I just
move
put it into phase 1 because the assumption is, and then the statement in phase 2 is all rules of phase 1 apply, but then these things are added. Or these things are removed.
So I'm gonna move this modified to phase 1 in modified quarantine. There. After incubation period and permitted by MCHD. In B, it's gonna say masks will be worn by close contacts in school settings, and continue with the rest of the sentence. I'm going to add a second sentence in B about testing rapid antigen every day up to the 6 days. We're going to change this, and if I move quarantine now, D will become 3 if you follow, because
Mhm.
this is going out of there. And I'll add to this statement, which will now become 3, about cohorting, modified seating, all of that as well. And I'll do it on 3 too, so just like you usually see on these types of plans. So when we get to phase 2, I'll say everything in phase 1 plus this. In phase 3, I would say everything in phase 1 and 2 plus this. So I'll add that to both those phase 2 and 3, and then get clarity from MCHD on this.
All of this is really relying on the health department to be responsive, right?
A great deal.
And we know how last year went. I got nothing against them. They're busy, and I think they made that clear. What have they done different to deal with that, to be able to help the Miami County school districts implement these plans? I only know of 2 people. I've only heard 2 people's names thrown out when we talk about the health department. Does that mean they only have 2 people doing all of this for the entire county? Who else is helping them?
Now they do have a staff of nurses that parents that they work as well. Yeah, obviously Rita is the director. Christina is I don't know her official title,
Yeah, those are the 2 names I've heard.
but
They've been pretty responsive to the schools though, trying to get these done, I think.
oh,
right?
definitely. But they do have a staff of registered nurses under them. And when we went to that meeting, not Tuesday, about a month ago, their staff nurses were there. In fact, when I first sent this to Christina, she definitely was back and forth with me for the final say and visit with Rita, but she actually turned it over to her staff nurses for review at first. So the answer to that, they have more staff than just Rita and Christina. And then they will, if they feel like they're at capacity, they will turn it over to KDHE. I guess I know personally when my one son had COVID in May, all the contact tracing with my wife and myself for him was through KDHE. I never once talked to Miami County Health Department. I probably had 3 or 4 calls from KDHE, and I think my wife did as well. So
How quick was it?
the first call was, if I had to guess, remember back, I would say within 72 hours. It seemed like that first one was.
That seems, 3 days seems a little long, which is why I mentioned what I did about phase 3, having some things in place so that we're not waiting for a phone call or a meeting. I personally think we need to have another phase 2A, something where we have some more universal precautions than what we're doing. I mean, I listed out the recommendations that are standard across federal, state, local, doctors, nurses, pediatric organizations, and vaccine, screening, testing, masks, distance, and hygiene are all those things. In phase 1, we're doing 2 of them really, of those 6.
When we're doing
And
hygiene
when
and
we
distance.
go to phase 2, we do step it up some. We talked about testing. That's not really stated in our plan. We're going to again rely on Miami County Health to perform that function, and it does rely on Miami County Health. It relies on parents and students. It relies on self-identification, and that it's unreliable. To me as a board member sitting here, that I have to rely on 4 or 5 different things, different entities or people in order to make this plan work. And if I'm just looking for a trigger at that threshold. If we get here, we take more drastic measures to make sure it doesn't spread instead of kind of waiting to see if it's going to spread or not. I just there's something missing in 2 and 3 if we're not going to say just up front, hey, you know what, we're going to do everything we can to keep this at bay and try to let the kids be free and breathe free and all that. Our goal, as many organizations have pointed out, kids need to be in school, and there's psychological impacts of many things. It's been argued that masks are causing some of that. I think it's universally accepted that not being in school is the largest psychological impact and educational impact on the kids. So if I look at what can I do to make sure the kids can stay in school, I think we need to be following the recommendations a little closer than what we are. So
maybe sorry.
So, I know I'm in the minority on a lot of this, but at least putting something in here with a threshold and a trigger somewhere in phase 2, so that if we do just start to see an incline, we're taking more universal measures to keep from having to have this phase 3 meeting that we're talking about.
Yeah, I was gonna say, even what if we did for phase 3, we put we're gonna follow CDC, so that's masking, all those things until a meeting can happen where we can determine, or just so that there's something in there that we know that's gonna happen until something can be decided. I don't know.
I mean, that's what I'm getting at. I hate it to turn into just simply a mask issue, because as soon as you say that, that's what it becomes. But I just listed off the 6 things that are recommended, and we're only doing 2 of them right now.
I guess
Well,
I'm curious
I don't
which
think
ones
we're ever
are.
going to mandate vaccines,
Exactly, my point.
right?
That's right. We're never going to.
We've had the discussion on masks.
What are the other 2?
And not
we're
to say,
doing?
and again,
Go ahead.
I was gonna say, and the argument has not been that, quote, masks don't work. There are settings and situations in masks do work, and then in general populations you have to define what works means. And works doesn't mean that you put a mask on a mannequin and show a reduction in particles through a simulated cough mechanically. Works means a randomized clinical trial where you control all other factors except for masks, and you look at the impact of masks on viral spread. Hasn't been done. We know that there was just a psychiatric evaluation study put out. I can pull it up if I need to, but that talked about the trauma response we're inducing in children of racial minorities and of low socioeconomic status, and that this trauma response will impact them for the rest of their lives in these especially in kids age group K through 5. We know, and so that science has just come out. So we have talked about the mask issue. As far as the diagnostic testing, we talked about that as well, that we're not a medical facility. So I mean, I understand what these organizations are pushing, but they're also not educational institutions. And we also have to go back to many times, time and time again, we just saw recently, I know I got harangued like crazy last board meeting, bringing up the Israel data and how we're starting to see lack of efficacy with these vaccines. Literally the next week and this week, CDC's come out with reports with huge concerns about lack of efficacy, and even quoting data out of Israel that said, and as a matter of fact, we're seeing increased risk of severe disease in those people who were vaccinated early in the pandemic. So, you know, it stops being Doug Shane's conspiracy theory when it's backed up by the very same organizations that I criticize. But, you know, we have discussed many of these things, and a lot of those recommendations also fail to take into account some of the negative. And so, especially as we think about those kids, when we're talking about a disease, again, that poses very, very little risk to the healthy child, we're inducing a trauma response too that cannot be reversed once we repeatedly keep doing it and doing it and doing it again. And we cannot just carelessly just say, yep, we're gonna go re-induce that trauma response again and again. And that's really where I get cautious of saying I want to be very cautious about broad sweeping, very restrictive measures. And so I hear you. I'm okay with even saying let's move the trigger to where we change the conversation. But those 6 items that some of these organizations are pushing forward, certainly I think for most of our community is a non-starter. We're not going to start. I mean, if we followed KDHE, we'd be putting vaccines in the arms of kids without parental consent. That's in their guidance that they issued out to schools. Like, well, as long as there's an adult around, it's okay. Their parent doesn't have to be there. Like, what? So, you know, I hear the concern and I understand the concern from the community, but we have to balance some stuff out with some of the realities of the situation at play. I think that we've got a lot of mitigation factors in place, a lot of them that have demonstrably worked very, very well and demonstrably can impact the course of a pandemic. We know for a fact that social distancing, quarantining, isolation practices, those are very, very important for controlling respiratory viruses. We know that for an absolute fact.
Did they work well?
Huh?
Did they work well? You said it was demonstrated that they worked well. Did quarantine and isolation work to reduce respiratory illness last year?
Certainly.
For us?
So for our district, I couldn't tell you. I can tell you that there's been studies published globally, and this even accounts for flu and other respiratory viruses over the decades, that certainly isolating sick individuals and their households certainly does mitigate the spread of a disease, because they're just literally not in contact with other people. They're not in the same airspace as other people. So yeah, absolutely. Yeah,
I would say, I mean,
you know,
in the health department, that we had 0 where we could believed any secondary case was because of the first one. But you know, the difference this year is, but you know, who knows, was that because of masks? No one will know. But all those other mitigation strategies we had.
Well, what I just heard was it was demonstrated that it was isolation and quarantine that prevented some of that, and you can correct me if I'm wrong, but that's what I heard you say.
yeah.
When
So
we did have some quarantines, that's absolutely true. But I go back to the first thing I said, the goal is to keep every single kid in school and not having to go home and worry about this 40-hour thing, worry about putting the teachers in the situation of having to do distance learning with that added burden. It's about keeping every single kid in school, every 1,116 hours that we're required to be here. I want every single kid to have that opportunity to be here.
I agree, but how do you know how to do that? No one has the answer to that.
What worked last year?
What?
What worked last year?
Yeah, but
well,
that's
I
it.
think that
there's no proof that really works.
That's
There's no
it worked
proof
last year.
throughout the whole country.
Yeah, I mean, so I can tell you, Oscar et al., this was published just, when was this published? May 21st. They looked at school districts in Florida, Massachusetts, and New York. They couldn't look at the impacts of mask mandates in schools in Massachusetts and New York because every school had a mask mandate in those states. But what they did find is that in schools, they did find that social distancing had a role in mitigating case burden. Now in Florida, when they subsetted those districts out and they looked at mask mandate versus not mask mandate, is that if you looked at them just raw numbers, it looked like maybe there was a few more cases in non-mask mandated schools than mask mandated. But when you adjusted that for community level prevalence and community spread in the community, that effect went away, and so it was not an impact of mask, it was an impact of community prevalence, and that the case burden wasn't in students, it was in teachers, and that those teachers likely acquired those infections outside of the school building. So, I mean, that study, this study would kind of say two things. One, yeah, okay, the social distancing and some of the quarantine isolation practices do work. The masks look like that they had either minimal or no effect.
Well,
on case
go ahead,
burden.
yeah,
Yep.
sorry. Go ahead, are you done? So, from the studies that I've seen, so my company, Henderson Engineers, is they did mathematical models on it, and in certain situations, so like enclosed spaces, tight spaces, they did show mathematically that masks do make a difference. I mean, and so it depends on situations, it depends on a lot of things. So, I mean, I'm not saying that's the right answer, I'm just saying that mathematically, through the studies that have been done with all sorts of respiratory illnesses, not just COVID, but flu, all that stuff, that it can make a difference. It's not obviously 100% or anything like that, but there is mathematical studies that show that it does make a difference, that it can reduce it some. I mean, in those models it shows a certain percentage that it can, but I wouldn't say that they don't work, because I do think that they do help. It's just one of the things, like it's just one of those pieces that can help with a situation. That's all I'm saying. So, I mean, I'm not saying that's the right or wrong answer.
And you haven't heard me say that they absolutely don't work, and there are situations in which
Right.
they're absolutely useless. You
Right,
haven't heard me say that.
Yeah.
I just don't think in the school setting that's the case, and we haven't had the cost benefit conversation. The CDC has failed to deliver that too. What's the cost of putting them on kids, right? What's the long-term effects? Where's the long-term safety evaluation of mask wearing on kids? And those kinds of things. Like, they haven't produced those kinds of information. And so to have a balanced conversation, you have to be able to also talk about those things. But, in today's society, we're not permitted to talk about those things. It's, mask or be quiet.
I'm pretty comfortable with what we've got here, and you said we could have, if we need to, we can have a meeting right away without having to wait the 3 days. I mean, if things get to the point, that's where we need to have a discussion again, I think.
We
It's
could
like
lower that 5% to, if memory suits me, and maybe you could ask Ms. Beer this, if memory suits me, the highest daily incidence during the peak of the pandemic was 1 to 2%. I believe if you looked at daily incidents for the pandemic,
I kind of like the
And
5%
so
because it
we
gives you
can-
more of a.
we could change it to 1 to 2% to trigger a meeting. Because 5%, if you're arguably, I think you're unlikely to ever hit that. If you look at when the pandemic was at its worst last year, you're at 1 to 2%. Of course, we had, I mean, how many total active cases did we ever have in our district last year? Do we know?
Oh, I don't
Not
know.
many?
Yeah,
A handful?
maybe.
Well, what about when sports team
And not acquired in
Well,
school.
he's saying
Active cases.
not
See, that's the other
quarantine.
thing is there was never any follow-up to say,
what's active? And
so
what's
if
not?
I quarantined 1,000 people,
Yeah.
how many actually ended up becoming positive? Because if 0
Right.
became positive, then I'm probably way too aggressive in my quarantine practices.
Yeah.
Now, if 20% of them became positive, then maybe it's more appropriate. But if I quarantined 1,000 and 0 became positive, probably being a little too aggressive with my quarantines. I'm probably quarantining a lot of people I don't need to. So, you know, and I think that's one of the nice things about this is that it lets us feel that out for a little bit and say, you know what? None of these kids that are quarantined are becoming positive. We need to have a conversation about how appropriate it is, you know, about how appropriate our practice is.
I'm satisfied with what we've got here personally, but
I think it's
I
a
think
great compromise for the
I think we
community.
should drop it down from 5% though. If you're looking at the high school, we should probably have a meeting after like 10 to 15 cases, I would think.
So in that 2.5% range, right? That'd be 2.5. Yeah,
2 to 2.5.
We have 600 students in the high school.
I agree with that, having, some sort of meeting, like, I'm good with lowering that as well.
2.5%. Okay. I'd be happy to compromise on that.
I would just say, these are protocols, so these are for, at the administrative level, for us, at the district level, our buildings, our teachers, coaches, to work with the health department. I feel like, based off district current policy, which when it comes to COVID is mask optional. I feel like everything's in there, besides the items that the board has chosen not to do. And so I think it's a very thorough one. So to put us to do more without your guys's, you guys are the policy makers. We are the policy, we make sure your policies that you approve are followed in the district. So it puts administrators, like, if we're asked to do more without your approval, that's not what I feel comfortable doing. So we will follow this because it follows your policy of a mask optional student. That's why at the top it's protocols. It's how we are following and interpreting the policy the board has set. So I think the two ones out there, the mask and then the vaccinations, but those have been discussed if the board wants us, because I've shared that we do have that ability to vaccinate and test in school. The board has chosen not to do those. And then on the mask, I do think all the other mitigation strategies that we had in place last year, they're listed, except, vaccinations and testing weren't as readily available last year, masking, but it's those three things that, if the board chooses to, through a policy decision, the protocols would then change to reflect that. Until they do, I think this encompasses what the board's current wishes and policy status is.
And all of the HVAC units, the filters, have they been upgraded to the
They have
MERV 13 or higher?
Yes.
Yeah.
And we've increased air exchanges, right?
We have, and then health rooms, we make sure that goes right to outside air, not comes into, we did have some of our older facilities. Obviously, we don't have a health room out here, but at Broadmoor, for example, so we have more of a sick child and a well child room, because we realized the HVAC at Broadmoor, which will be updated next summer, but not this school year, was just it was central air. So what was going out of so we've changed that. We have ultraviolet lights in those offices as well.
I think there's been some nice literature on air exchanges and ventilation and case burden.
Yeah,
especially in nursing homes.
That same study that I was referencing went through all sorts of different steps. So, the filters, the UV, the mask, they kind of went through all the scenarios. And one of the scenarios was in a classroom as well.
I have dedicated
I can send it to you if you just want to take a look at it. If anybody wants to take a look at it, I can send it to you just to check it out.
Our ESSER 3 application is due today, so Katie and I submitted that, and I have dedicated $300,000 of our ESSER 3 dollars to help with the upgrade of the HVAC system at Broadmoor when we get to that. I did $49,000, I think, out here at Circle Grove, part of that. That's not what it cost, but of ESSER dollars, so ESSER 2 out here and then ESSER 3 for Broadmoor. So hopefully the state approves that, but out of our roughly $900,000 we get of that for not this school year, but next school year and the following. So about a third of that went. We are required for ESSER 3, 20% has to go to identified evidence-based learning loss opportunities, which we have that in there too. But then $300,000, I did that for the HVAC system over there. And that was just submitted last night. Cool.
What, since the, remote learning kind of tying our hands on stuff, what do we do if we have like a classroom or a building that has to be shut down for a month? I mean, we can obviously send some homework home, but we're maxed at 40 hours. I mean, that's 40 hours isn't
A week. Our instructional week is not 40, so it'd probably be about 6 days.
Mhm.
What you probably know, our count date's usually 6 hours a day, something? What is it?
Yeah, well, 400 and 395 minutes.
395 a day is what we do.
Instructional.
Yeah. So we almost could do 6 days. If it happens after September 20th, it won't be from a funding standpoint. Our model was excellent last year, and I can't speak for our legislators that changed that. I don't think they looked at Louisburg why they changed that but they changed it because a lot of districts that say they were doing remote learning, the kids were not doing anything. I mean, our model last year take Nikki Cash in kindergarten. She was teaching that kiddo from 8 to 3 versus this. So that model worked in our data, and Mr. Tappan kind of showed our state assessments or local assessments. We saw growth, but I think our legislators they didn't see that type of growth. They heard a lot of stories from parents and others that that model wasn't working, and so I can't tell you for sure, but I would believe if everyone was doing our model last year, that would not have been passed. But it unfortunately does tie our hands to that. So yeah, we would do the best we can. We could go the virtual route and enroll in. We do have that K-12 option. So hopefully we don't get to that.
So with that though, because I know the curriculum isn't, we don't set that curriculum right because it's through Ingenuity and stuff. So how do you throw them in for a month and find where the material kind of lines up with what we're doing in the classroom?
We are, and we've done that at the secondary. We do modify the Ingenuity. It's modifiable, and Mr. Tapper can speak on that, but our teachers can go in there and make sure it matches closely to what they're doing. Okay. So that would be part of that if we had to go that route and use the virtual route versus that. Then, our teachers will already be on staff. If they're not teaching kids, they would be able to spend their time making sure an sophomore English class or an Algebra 2 class is the same scope and sequence as they were going to be doing, and when they came back, they'd be able to do that. That's fair to say, right, Mr. Tappan? They're modifiable?
Yeah, it would take some time, just like when we went into the virtual mode back in the spring of 2020. There would be some time where the teachers would need to go through the Ingenuity program and make sure that the standards that have already been taught maybe were deleted from that unit or from that course, and then make sure content would be different, resources would be different.
Right.
That would be probably the learning curve for our staff.
Now, K-5, we've partnered with Greenbush. In fact, you watch the news and listen to sounds like a lot of the Johnson County schools have as well, because as the reporters are in front of Piper High School or Shawnee Mission South, and they're talking about their options. I've heard a lot of them in the last week say, about the virtual options, and they're saying, so Greenbush is getting a lot of good press, but they're saying, and they have partnered with Greenbush as well, Service Center, for those options. So I can't ask specifically our answer about that program. They would be teaching obviously the Kansas standards and all that, but as far as where they were, I don't know. And we would work as well as we could with Greenbush with the elementary end, but I definitely can answer the secondary one on that one.
Yeah, well, arguably the legislature will probably have to revisit that if the students' attendance in school was not driven by the school itself, right? It doesn't seem reasonable to hold us responsible for a student that, if the county health department quarantines them 4 times in the course of a school year, right? That's
so just what and I guess the other thing I think why legislators react, there were a lot of schools they wanted kids in school, and there were many, even in the metro, a lot of schools didn't get back to school till March, even April. So that was kind of part of the bill as well. So there's always some byproducts of it, and we hope we don't have to get there. But yeah, it is 40 hours. We'll monitor that and hopefully not have to go that route. When a kid is, but if a kid is, say, tests positive and then they're home, that's not counting towards those hours, because that would not have been the old formula. So like, for example, our one student that's out now, that's not, if that student has elected just to give me worksheets and all that, that's not triggering the remote, because that teacher's not remoting in and
Right.
teaching that like we did. So that's where the remote would come, where we're actually going to that phase of teacher remoting into that household. Well, I will add the changes. I will get with MCHD ASAP, depending on their schedule. I know the biggest one is this right here. Get some clarity on that, and send that back out to you guys as well. And I know that's going to 2.5, so that was the last one. That you'll see that change as well.
So with that, I'd move to table a vote on this until we hear back from MCHD on item 5. And we'll hold a vote once we have clarification, so we know what we're voting on.
So you're right, it'll be a proxy vote via email?
Yep, I'd be okay with that.
Okay.
Is there a second for that?
I'll second.
Discussion. All those in favor say aye.
Aye.
Those opposed? Adjourn special board of education meeting. I move to adjourn the August 20th, 2021 USD 416 special board meeting.
Second?
Any discussion? All those in favor say aye.
Aye.
Those opposed?
Gotta run to chamber function and run.